So hi guys, I am Dr. Telly Bogler. I'm a family physician and I practice low-risk obstetrics at St. Michael's Hospital. And this is my wonderful colleague, Dr. Ellie Shore.
Hi,
Ellie.
I'm Ellie Shore. I'm an obstetrician gynecologist. I also practice at St. Michael's Hospital, and Telly and I are thrilled to be here and thank Alana for the invitation to share some really up-to-date and medical-based knowledge with you all about COVID-19 and pregnancy and delivery.
Yeah, that's great. Okay, so for everyone just joining, just if you can just type message, let us know if you're pregnant or if you recently delivered and how many weeks you guys are either pregnant or postpartum. If you feel comfortable to share, otherwise no worries at all. So we're going to get started and basically just give a little bit of background about At Pandemic Pregnancy Guide. That's our Instagram account. Go check it out. We have a Twitter handle, but we don't really use Twitter as much because we know our moms or moms-to-be are on Instagram. So that's basically the story behind Pandemic Pregnancy Guide is I'm a mom of twins. Ellie has 2 boys herself. And, you know, we're obviously, you know, right there following our patients while they're pregnant and delivering. And we saw the anxiety in our patients right away when, you know, it was declared a pandemic on March 11th or whenever that was. And we both just felt the anxiety. It was palpable. And we really felt that we wanted to help women during this time as much as possible. We wanted women to get the right, accurate, reliable medical information that was free because there's so much misinformation out there. And we really just wanted to be a resource. And we really just wanted to support expecting parents during this time. So we thought we would create this virtual platform to provide information to, we thought would just be our St. Michael's patients. We thought it would be a few hundred patients, right, Ellie, when we started. And quickly over a few months, we really, it just grew. And so now we have almost, I think just like over 12,000 followers or so.
Sorry,
Ellie,
I know, I'm trying to figure out how to do it.
Yeah, so that's our handle and it's grown. And I think the reason it's grown is because all of us are seeking accurate information. There's so much out there, like it's crazy. And we just all want reliable, factual medical information. And so that's our goal. That's what we've been trying to do. And hopefully we've helped out some of you who have been following us. Okay. Ellie.
Yeah. I know.
So that's, yeah. So that's just, that's who we started this with, some medical students. Had my first with Dr. Berger. Oh, Dr. Berger was also my OB. Yeah. We started off just a few of us and some medical students who really wanted to help, who had an interest in obstetrics and women's health. And now we've grown a little bit to have some other wonderful medical students with us. Laura Diamond's on this talk right now. Laura, you can say hi. She's a medical student with an interest in women's health and obstetrics and pediatrics. We have this wonderful team. They're University of Toronto medical students who are helping us, and it's all volunteer based. We don't have $1 really to support us. We're really just all doing this just to really provide accurate information. Okay. Ellie, why does it say slide 5 in captions all over? Thanks. Okay, so big question that's come up now. Ellie, are you having difficulties?
No, I don't know. It doesn't say that.
Oh, you look like you are. I don't know why.
I'm trying to get it open on.
It keeps on saying, it keeps on showing like exit and captions and stuff like that.
Okay.
Remove it.
Well, does it look normal now?
Yes.
Okay, so I'll just stay off of the hop-in. Okay, go ahead.
Perfect. Okay. So one of the big questions that we've been getting right now is, should I avoid getting pregnant? Obviously, most of the people on this session are pregnant. So don't be nervous, don't be scared. The answer is no. You should not avoid getting pregnant during this time. If you're already pregnant, we are not concerned about that. But just for some people that are thinking about getting pregnant or whether or not this is a good time, there's a really interesting and very reputable opinion article that came out in the New England Journal of Medicine. And this is one of our most reputable medical journals that we all refer to. And the authors list criteria on when we would actually recommend avoiding getting pregnant. So I'll just list through them quickly is, the pregnancy-related risks associated should be well understood. Well, they're not totally well understood just yet in terms of COVID-19. The pregnancy-related risks would be higher than those for conditions that you would commonly see in pregnant people. So we know that people with diabetes, for example, there are certain complications, and we're not telling patients with diabetes not to get pregnant. The pregnancy-related risks cannot be minimized. Well, we know we can actually minimize getting COVID-19. We know if you follow public health guidelines, wearing a mask, washing your hands, keeping distance, those all are, effective ways of mitigating or minimizing the risk of getting exposed. And so the list goes on, and basically the recommendation is there is nothing to suggest that COVID-19 meets the criteria to recommend against getting pregnant during this public health crisis.
So keep us busy, get pregnant. We'd love to see you here at St. Mike's.
One of the other major questions that we've had from our followers is, are there any changes to my prenatal care due to the pandemic? And so what we want to explain is the number of visits of prenatal care visits has not changed during the pandemic. We know that pregnant individuals need to be seen on a routine basis, and that has not changed. What has changed is that some of those visits can now be done virtually. So, for example, around 20, I don't know if you want to say like around 16 weeks, when there's no other ultrasound done at the time or other investigations, we're often doing that visit virtually over the phone and asking the pregnant individual to take their weight, tell us how they're feeling, and then the subsequent visit will be in person. The other thing we're really trying to do during the pandemic is when you have an ultrasound booked, that's when we're bundling the visits together. So if you're coming in anyways for an ultrasound, that's when we'll do the prenatal visit. If you're coming in anyways for blood work or a swab, we'll do the prenatal visit at that time. So we're trying to bundle visits, doing every other visit, sometimes virtually, if it's safe and you're a low-risk pregnant patient. And the last thing that you will find at hospitals is that there is a no visitor policy. And this is a big change for many people because they're used to having, if they've had a previous pregnancy, their partner there in the ultrasound or for appointments. So this has changed, at most academic hospitals, not allowing a partner to come in for visits or for ultrasounds. We're hoping that this will change. Now that we're in the second wave, it's not changing currently, but that's something to keep in mind as well. There are innovative ways and important ways to keep your partner involved, whether it's, I know, Dr. Shore, at your appointments, you'll Skype, you'll do FaceTime or Zoom, or have the partner call in for the questions and everything. So there's ways to still engage the partner, but that is an important change that's happened during the pandemic.
And and we would just say, talk to your providers. We know that this is unusual, but we're all, want to make this as positive an experience for you as possible.
Yes, and some ultrasounds places do allow you to bring a partner. So for example, just next to St. Michael's Hospital, there's a private ultrasound clinic that is allowing partners to come, and that is an option. I just find that most ultrasound departments that are affiliated with the hospital, because the hospitals are a little bit stricter with visitor policies, probably wouldn't allow a partner to come in. But you're right, there are some ultrasound clinics that are allowing partners to come. So that's a good point. What should I pack in my hospital bag? So Dr. Shore, why don't you take it away?
So as Telly mentioned, when we started this site or platform at the beginning, we wanted to hit on some of the things that were specific to COVID-19 and then some just general pregnancy tips. And things are a little bit different with COVID-19. Just something we forgot to mention at the beginning was that we have now a lot of content on our platform. So we have created a table of contents that you can go, it's in the link in our bio, and it basically breaks everything down by topic and date and things like that. So you can take a look and refer back to any of the things that we're talking about today, because most of them came from different posts and stories that we've done. So in terms of what to pack in your hospital bag, we compiled a list that has everything from a variety of different hospitals. The main things that are specific to COVID-19 is, as Tully was talking about, we have to be creative using technology in terms of communicating with friends and families. So remembering to bring various devices and the chargers that go with those devices is important. The other thing is, in case anyone was confused, the decreased visitors is mainly around clinic visits, but for the hospital, most people are allowed to bring a person with them, and we'll talk about that. So just remembering them in your hospital bag. So bringing a change of clothes, or
remember your support person.
or make them pack their own bag. I don't know. If your partners are anything like my partner, I'm in charge of all things packing. So making sure to bring clothes and food and the toiletries that they would need. So this goes on to the next thing that we wanted to talk about, is that many hospitals have a one support person rule during labor and delivery, and that's to minimize the spread of infection. What do we think will be happening with this policy? So we've seen a variety of things since the beginning of the pandemic. And most hospitals, in terms of labor and delivery and the neonatal intensive care unit, really recognize the importance of a support person to the pregnant individual throughout the labor and delivery, and as well as postpartum process, because we know that there are medically important roles for them to play in terms of good birth outcomes, but also psychologically important roles to play. So all centers are doing whatever they can to facilitate a support person coming to the hospital and being there with you. Every hospital has slightly different policies, but most of them involve, screening you, screening the partner for symptoms, and also just some various policies around in and out privileges and things like that. But really important to talk to your care provider about the hospital specific policies. And then this also kind of leads into, is the hospital a safe place to deliver? Well, it actually is. And I would argue it's probably the safest place to deliver. First of all, at the hospital, as I mentioned, we have lots of screening in place to make sure the people entering are, healthy. The other thing is we have all the necessary protective equipment to wear, like masks and face shields. So I actually feel much safer at work than I do going to a grocery store or a mall or something like that. And was a recent study, as Tully mentioned, there's a few journals that we refer to in medicine, and another one is called JAMA, and JAMA published a study looking at the number of visits during a pregnancy and if there was any correlation with COVID-19, and they didn't see that there was any increased risk of getting COVID-19. Is the hospital is the safe place to deliver, and it's where you want to be if you're in an emergency situation. And then on to this, like we were talking about personal protective equipment. So most hospitals are providing masks to patients in labor if they don't come with their own masks. Again, in terms of enforcing it, I would say it's probably hospital dependent. I think places are more strict if the person, if we're worried about the person having COVID because they have a fever or respiratory symptoms, or if they have a positive COVID test. Those are reasons where we would be quite strict with wearing the mask. But for most laboring patients, we're not particularly strict about wearing the mask because we are all gowned, masked, face shields, and your partner or support person in labor is also protecting themselves with the mask. And just to remember, the mask is partly to protect the other people in the room, but it also protects you too because there's less droplets on your face and things like that.
Yeah, and just I think I'm just gonna add, like, so many people have been asking, like, do I need to wear a mask while pushing? Like, so many of my patients, and I can tell you that we give them, like at St. Mike's, for example, we give the mask to the patient to wear, and their partner was wearing it all throughout. And you know, there are times during pushing it's not possible to wear a mask. Either you're feeling nauseous or you're sweating. It's not, you know, it's not possible. And the laboring person does take off their mask, and no one's going to enforce that. Like, we want a safe, healthy, we want you to push, you know, as comfortably as possible. And so yes, we are giving the mask, but I think everyone in the room understands the circumstances. It's not always possible, especially while pushing. And everyone else in the room is wearing the face shield, the mask, and everything to protect everyone else in the room.
Yeah, so mask wearing, definitely a hot topic. The next question is, are there any, or a question that comes up a lot, is there any changes to pain management options during labor? So the pain management options have stayed the same for the most part. The majority of our patients are, tend to get epidurals. And that I don't think has changed much with COVID. That's sort of what people were tending to do before. The biggest change is that nitrous gas or laughing gas is considered an aerosolizing procedure. And so we are trying to minimize aerosolizing procedures. So some hospitals may not be allowing laughing gas during labor, but there are other things that you can use. So there's the epidural, there's a patient, like a controlled pump. There are injections we can give you if you need it. So we do have, and then there's local injections that can be given in the vagina and things like that. So there are lots of different options for pain management.
Yeah. And just to add to that, it's not that they think that it's necessarily an aerosolizing procedure, is that there's this valve on the mask of the nitrous oxide that they can't be confident that can be properly cleaned. Anyways, the thing is, there are some places in Canada that have reintroduced nitrous oxide, and there's some discussion about reintroducing it too, but currently right now, it's not a common practice to have it reintroduced. They were being just extra careful because of the fear of spreading COVID-19, but that's just sort of the rationale behind it. And hopefully we will see it back on the floors. And the same thing is if you were planning on delivering at a birthing center, they don't have nitrous oxide either. Correct me if I'm wrong, but that was the recommendation. So nobody basically was using nitrous oxide, and it's still not clear if it's going to be reintroduced or when.
Thanks, Kelly.
Yeah,
so, we talked about that the hospital is a safe place. Tali, why don't you answer this question about what do we do when we leave the hospital? Do we need to do anything different?
Yeah. So I think this goes hand in hand, sort of, Ellie, with what you were talking about like people, this fear of like delivering in hospital. Am I going to get COVID-19? And although like it's understandable that people had that sense of worry, and I think we saw that earlier on in the pregnancy, I'm actually not seeing that as much in my patients anymore, that fear of coming into hospital. But just as Dr. Shore explained, like everyone in the hospital is getting screened. Like everyone's wearing PPE. People are getting isolated if we're worried about potential COVID-19. We're swabbing people. We're doing all the necessary precautions that are in place. It's so safe that, as Ellie said, like I feel really safe coming into the hospital every day as opposed to going grocery shopping where no one's screened and I don't know what's happening. And some people have their masks on their chin. Like you don't see that in the hospital. So just as Ellie said, it's a safe place to deliver. It's also why you don't need to isolate 14 days after leaving the hospital. You're not getting more exposed in the hospital. You don't need to isolate for 2 weeks after leaving the hospital. Do birthing people have to get screened coming into L&D? Yes, they do get screened. Everyone gets screened coming into the hospital. You can't actually sort of enter the hospital without.
And that's for usually outpatient appointments as well as,
as well as coming into the hospital to deliver. Yeah, sorry, swabs. No, they're not getting swabbed routinely. They're only getting swabbed if we're suspicious of COVID-19, if there had been an exposure or they.
It's frozen for me.
Is your screen freezing a little bit?
I don't know.
So I see the screen now. So can close family friends and family visit postpartum if they have been social distancing. And you can just go to the next slide, actually, Ellie, because I put a little screenshot of the article that I wrote for today's parent. So this is also one of the most like common questions we've been receiving, like how do I introduce the baby to loved ones? It's one of the most common concerns that we're seeing. We did a study on this. This is like the number one question, right? Because this is like such an important part in our lives, right? And we want to be able to share that with our family members and grandparents. They want to be involved. And so I think the thing we need to think about is who's most at risk. So what we found, and we'll talk about this in a little bit, newborns, babies, even with COVID-19, have generally done extremely, extremely well and have had mild symptoms. Okay, you as the pregnant person, who just delivered are also not more at risk, or your partner, let's say, if they're healthy and the same age at a young age. So the people that are most at risk are, the grandparents in this situation. And so a couple of things to keep in mind, like how do we, like I talk about harm reduction kind of thing, like how do we introduce the baby to our loved ones in a safe way? So while the weather is still nice, or with heating lamps, do it outdoors, wear a mask, meticulous hand hygiene by everyone. And just weighing, everyone being aware of the risks associated with meeting. And at the end of the day, the grandparents can also, choose and make a decision and know the risks as well. So that's, anyways, you can read the article and I give specific sort of suggestions on how to introduce the baby to loved ones safely. And yes, people are feeling anxious. So there's been large studies that have come out in Canada. There's one in Calgary and Quebec, looking at lots of women, and we have found higher levels of anxiety, depression, and distress in pregnant patients during the pandemic. It's already a vulnerable time, right? I was there just a few years ago with my twin pregnancy and feeling, vulnerable just at the best of times, right? And then you introduce this pandemic, of course, and there's so many unknowns and questions. So of course, there's more anxiety. It's understandable. So I think first thing I want to say is check out our Instagram account, because honestly, it was created out of the love in our hearts to really support people during this time. And we have counselors that come on. We have free exercise classes. We're trying to answer all the medical questions that people have so that hopefully it can lessen your anxiety. And those were some resources that Ellie pointed out. Okay, we have a few minutes left, so we want to talk about what are the risks of getting COVID-19 in pregnancy and what will happen to the baby if I get it. So what is, as of October, what's the date today? Like 14th, 15th?
It's my mom.
As of October 15th, what is the most up-to-date evidence? Okay, so here it is. You're going to get it from me. And Ellie, feel free to jump in at any point if I, say something or say something that's incorrect. Okay, so we're going to split it up into pregnant and baby. So first of all, I want to reassure all pregnant patients that you are not more at risk of contracting COVID-19 than your partner or your neighbor. So you are not more at risk than anybody else of the same age. So first of all, you need to get COVID-19. So if you're doing all the public health measures like hand washing, mask wearing, keeping distancing as possible, you shouldn't be getting COVID-19. But if you were to get COVID-19, so again, you're not more at risk. If you were to get COVID-19, there are some studies showing that pregnant women are, and this is recent study from the States, so we don't know 100% if we can extrapolate that to Canada, but there have been studies reported by the CDC and the MMWR that reported that pregnant women with COVID-19 were more likely to have serious symptoms. For example, being more likely to be admitted into the intensive care unit, the ICU, so 1.5 times more likely, and 1.7 more times likely requiring ventilation than other women of the same age that were not pregnant with with COVID-19. Sorry. What we also found, though, is that pregnant women with COVID-19 were not at an increased risk for death. Okay, so just to reiterate that, you're not at more increased risk of getting COVID-19, but if you get COVID-19, you might be might be more at increased risk of having more serious symptoms like the ICU or ventilation, not for increased risk of dying. Okay, I know we're talking about some serious stuff, but these are the questions people want to know, and I know that because all my patients are asking me and everyone on PPG. The other thing is, so who out of those pregnant patients are more at risk of having serious outcomes? So a recent study was a big study looking at many different studies published in the British Medical Journal, the BMJ. They looked and they found that the pregnant women who had more serious outcomes had underlying medical conditions. So those medical conditions were they had prior to their pregnancy, so pre-existing medical conditions like diabetes before their pregnancy, high blood pressure before their pregnancy. They were of older age, older than 35, even though for many of us that's not old. Most of our pregnant patients are getting, are having children at that age, but they did find that older than 35 and having a pre-pregnancy BMI of over 30, so being obese, those patients were more likely to have more serious outcomes of COVID-19. Any questions about that so far? Did that explain things a little bit? Ellie? Yeah, Ellie's like, we're gonna run out of time. Okay.
Now you came into the clinic.
Yes.
Yeah.
Okay, good. Everyone's saying yes.
Yeah.
What's that, Ellie?
No.
You have a clinic?
No, someone
okay.
came in.
And the other thing I just want to say is that those patients also were more likely to have a premature baby and have that baby admitted to the NICU. Okay. So that's what I'm going to say about the mom. Now, the wonderful, amazing, reassuring news in terms of the baby is that getting COVID-19 while you're pregnant and transmitting to the baby, we call it vertical transmission, occurs very, very, very rarely. The other wonderful news that we have as of October 15 is that there has been no evidence to support an association between COVID-19 and birth defects, right? So all that scare from Zika and what does this mean? Is this like Zika? There's no evidence to show that. And the third thing is that the babies born to moms with COVID-19, this is like hot off the press as of October 12th, there were like 100 babies born to COVID-19 moms in New York City, and none of them had symptoms of COVID-19. They were all roomed in with the mom and breastfeeding, and they were followed at 2 weeks of age, and they were all doing well. So that is super, super, super reassuring, and that is like probably the most important thing I want to explain to people right now. So yes, it is safe to breastfeed. The WHO has recommended that even with COVID-19, it is safe to breastfeed. And there's actually some evidence that's showing that you might even have an immune protection if you've had COVID-19 that you can pass through the breast milk.
Cool.
Yeah.
We're almost.
And then in terms of baby care, I'll just say that your children need to come in for vaccines still, even during the pandemic. The only thing that's changed is the 1 month visit because that doesn't have vaccines. Often many care providers are doing that virtually. And around 9 months, because it doesn't have a vaccine, many care providers are doing virtually unless there's a concern. So super important to still come in specifically for those appointments that have vaccines.
And like if you have older children, there may be some changes to their appointment schedule if there aren't vaccines or certain like tests that need to be done in conjunction with it. So you could talk to your care provider about that.
So again, Melissa, I saw that last question. There have been no studies showing any birth defects with COVID-19, even in the first trimester. This is as of today, so but that's very reassuring.
And like we know that this is kind of scary because evidence is constantly evolving and, it is a new disease. But the thing is, even though it's new, it's still been around since December, and lots of pregnant people in other parts of the world have been pregnant with COVID. And so even though it's new, there's certainly enough evidence from all of these experiences that if we were seeing things like birth defects or problems, we would have heard about it by now.
Katerina, go for a walk with your infant. Oh, in an indoor area in the winter? I mean, as long as you're distance and you're staying away, anyways, we can talk about personal things, but I personally think it's fine.
Yeah, and I mean, I think it will depend on what the numbers are like then, right? So we don't know yet what the numbers are going to be, but you can also take your infant outside for walks. Like my first was in January, And we went outside, you know, almost every day from February onwards. So even if it's not, you know, a great day, it's still really important for you and your baby to get outside. You just have to bundle up accordingly.
There was a public breastfeeding question above if you were able to address, but breastfeeding in public, I mean, it doesn't really matter where you breastfeed as long as you're following public health recommendations. So before you breastfeed, you know, making sure you wash your hands. If you're out in public or an indoor setting, you should still be wearing a mask while you breastfeed if you touch anything, and staying away from other people. And I think if you just follow those public health measures, then you should be okay. You should be fine.
Yeah, your baby is not going to be wearing a mask wherever you are. So whether you breastfeed in public or in private, like if you're taking your baby to that public place, let's say, and that's okay if you feel comfortable, then the risk is the same whether they're sitting in a, you know, stroller or breastfeeding. I don't think you're increasing your baby's.
And I think everyone needs to keep reminding themselves that babies that were born to moms with COVID-19 had no symptoms and have been doing well. Children, young children with COVID-19 had very mild symptoms. So this is all really reassuring stuff. And we're happy, like, come follow us on PPG. If anything changes, we're not afraid to share it. Like, we'll share, you know, the good and the bad. We find that a lot of the anxiety comes from not knowing the information. And so we just want to provide it and know that we're not influenced by anyone. We're just trying to really provide accurate information. Anyways.
So follow us, message us. If there are other topics you want to hear or see on PPG, send us a DM. We're always looking for content, and we just really want to be a great source of, you know, support and information for patients and their partners going through this, because we know it's a really challenging time. Yeah. And also, Dr. Bogler and I are always accepting new obstetrical patients too.
Come over to St. Mike's. I delivered here. I'm biased. I had my twins here. I had the
babies. It's the best.
Oh, you delivered both here too? Oh yeah, you did. I forgot. Sorry. Yeah.
Are there any other questions out there, or are people happy?
Great.
All right.
Well, enjoy the rest of Mom's TO.
Yeah, enjoy, and thanks again for having us. It was really nice to be part of it.
Hi, Lisa. Okay. Bye, everyone. Have a great afternoon.
Bye.